Aloha, everybody. Every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, diverticulosis. Good morning.
Good morning.
Okay, so some people, like myself, may have never heard of this, but we hear it's actually very common. What is diverticulosis and how do adults get this?
Diverticulosis is an outpouching of the colon into a bleb, and it occurs in about 20% of those aged 40 and 60%, more than half, of those that are aged 60. Diverticula are limited to the sigmoid colon, or the last portion of the colon, in about 2/3 of patients, and Asians have an increased risk of diverticulosis in the right side of the colon, about 20%.
Oh, interesting. And what do you mean by outpouching?
If you look at the colon as a big tube and you see a bleb, and it's on your screen right now, those blebs are diverticuli, and they can be filled with material like bacteria or food, and they can perforate. They can actually have little microscopic perforations or large perforations, and that's the serious disease of diverticulitis.
Ah, interesting. Okay, so what are the symptoms of diverticulosis, if there are any?
Diverticulosis is frequently without any symptoms, Kelly,
Okay.
and a couple of them occur, and one of them is bleeding in the diverticulum, which can cause bleeding in the stool in about 10% of patients with diverticulosis. And then, of course, the other major risk, of course, is diverticulitis that we were just talking about, which is an infection or inflammation of the diverticulum.
And then does the diverticulitis have different symptoms?
Oh, yes. Diverticulitis can present with pain in the left lower belly, where the diverticulum are in most patients. Asians actually, as I said, have an increased risk of diverticuli in the right lower belly, so the pain can be there. Also, nausea and vomiting can occur, and a low-grade fever is common. You can have constipation or diarrhea.
Oh, not comfortable.
No.
All right, what are some of the risk factors associated with these?
Diverticulosis is associated with a high diet in red meats and a low fiber diet and lack of exercise, being overweight, and smoking. And non-steroidal anti-inflammatories such as Advil and Aleve, as well as steroids and narcotics, can increase the risk of diverticulosis.
Okay, and then what about, I'm assuming are the risk factors similar then for diverticulitis as well then?
Yes.
Okay.
About 5 to 15% of patients with diverticulosis end up with diverticulitis.
Okay, so on the smaller end of the spectrum then, it's not necessarily if you have diverticulosis, it's going to develop into that.
Correct.
Okay, good to know. So what, if you do have this, how are you diagnosed?
Well, you go into the doctor. As I said, that pain in the left lower belly is the most common symptom associated with the other things. And diverticulitis can be, obviously, in review, a perforation of the diverticulum. Okay. The average age for diverticulitis is 63.
So is that something that they commonly check for then if you get a colonoscopy?
The colonoscopy is at the end of the recovery of diverticulitis because colon cancer at the margin of the diverticulum can be the cause of diverticulosis. So it's important to get a colonoscopy after you're cured.
After, okay.
But during the actual episode, you can be treated as an outpatient or in the hospital, and sometimes even with surgery.
Oh, interesting. So what are the treatments?
The treatments are oral antibiotics, fluids starting with a clear liquid diet, and pain medication because the pain is severe in outpatients. And if you're in the hospital, IV antibiotics, fluids, and again, pain medication.
Wow, so there's a lot that then goes into it.
Yes, indeed.
Okay, and we were talking about, two already serious conditions, but could these possibly lead to a more serious disease?
Well, if the diverticulum perforates in a large portion, then you can get infection throughout the entire belly,
Oh, wow.
and that is serious. That's called peritonitis, and sometimes people end up with a bag from peritonitis surgically. So it's a very serious condition, and diverticulosis and diverticulitis should be prevented and treated aggressively.
Okay, wow. Well, thanks so much, Dr. Brady, for breaking that down for us. Again, it's something that maybe some of us haven't heard about, but it's actually really, really common, so a lot of people have heard of this.
Common diseases.
Cool. Well, thanks so much for breaking that down. What are we breaking down next week?
That's going to be a surprise.
A surprise? I'm excited. I'm intrigued. All right, tune in next Thursday, yes?
Right.
All right, thanks so much, Dr.
You're
Brady.
welcome.